So, first question is, how often do you work with or encounter cadavers in your role as a nurse, and in what context does this occur?
You mean like cadavers and patients that passed away?
Yeah.
Oh, quite a bit. In ICU and Emerge, quite a few people passed away. I'm trying to think of my last shift. The lady died. She had intestinal surgery and didn't go well. And we gave her 36 units of blood and she still passed away. So, like when I work, probably almost every shift. Yeah. What was the other question? It was how often?
Yeah. Or like, I think that was it. That like covered the question. But like also like in, yeah.
Yeah, because when you work in critical care, and Abbotsford's a trauma center, so I work in the trauma bay. So a lot of people come in with, I won't go into the gory details, but a lot of people come in with like bad accidents, and then in ICU there's people dying every day. Yeah.
Okay. So, my throat kind of cracks sometimes. Did you have exposure to cadaver dissection during your nursing education? If so, how did it shape your understanding of the human anatomy and patient care?
Okay, I never experienced a patient that passed away when I was in nursing school. The first time I experienced it was on Halloween, and there was a guy dressed as the Grim Reaper at the hospital for Halloween, totally inappropriate, and he was like the director of the hospital, and in Emerge, my patient just died, and so I just saw that he died, and I was a new grad, so I kind of freaked out a little bit, and I started walking down the hallway to get to my like head nurse, and he was walking down the hallway like the Grim Reaper, and I thought I was in hell for a second, because I was like, oh my goodness, like, did I just die too and go to hell? And I almost shit myself. Okay, maybe don't record that, but I was so scared. I like was about to throw up, and then I noticed that it was the director of the hospital, and I was like, get out of here right now, the family's on their way. I was like, at least I saw him. So that was my first experience. It was pretty traumatic. And as I was putting him into the body bag, his arm flopped on my leg, and I almost died. I was so scared. But yeah, so I was not comfortable at first, and no amount of education can prepare you for that. So I was pretty traumatized. Yeah. So it was pretty traumatic. Yeah. So they did talk about like how to prepare a body, what to do with the family, but in actual reality, it's way different. Yes. Maybe a YouTube video would help. I don't know. I don't know if you're allowed to videotape that. Yeah.
Okay. What ethical concerns do you think arise in the use of cadavers for medical education or research, and how are they addressed?
Oh, in medical education. Oh yeah, they're very respectful. So when we deal with cadavers at the, like in school or whatever, they're very respectful of the bodies. So they cover them up. Usually they cover up their faces too, and they don't use them for dissection unless they use like the whole patient. Yeah, so I feel like they're very respectful. Yeah. Did I answer? What was the other question?
Like ethical concerns.
Ethical concerns. Yeah, I think the ethical concerns are also not, they don't have the names on them. So say it was a family member like that, they don't put the names. It's and then two, once they donate, like my friend that's the head of the pathology lab at the hospital or at UBC Medicine, you're not allowed to like destroy any of the remains. So once you get them, you have to preserve them. So yeah, you have to treat it like actual human remain. Like you're not allowed to leave it in your car. When she brings it to us at the school, we're not allowed to like leave it unsupervised at all with the students. Yeah, so you do treat it with like a lot of respect, and we always say thank you to the donors that donated, and the students definitely are very respectful of it too. Yeah, because usually it's not like a whole body that we deal with. Like it might be the liver or like the lungs or the heart, so like different body parts. Yeah.
How does the healthcare system ensure respect for cultural and religious beliefs when dealing with cadavers?
Oh, that's a good question. Like, So we have some people that once the patient passes away, they need to stay there for certain periods, like I think some Middle Eastern patients. So even though we already basically need the bed as soon as the patient died, we do respect that and let them stay there. Or if they like are indigenous and they want to do special ceremonies, there's special rooms that allow smoke and other things. So if we do definitely respect that need. But like I think sometimes it's hard if patients are like Catholic or whatever, and they need the pastor to give or the priest to give last rites. It's hard to get priests or pastors to come because a few times I phoned and they said I'm busy having tea. And I'm like, okay, well this patient's dying. So sometimes you don't always have people available to give what they need in terms of their religious leaders. Yeah, so that gets kind of frustrating. But yeah, generally we are able to respect that. But yeah, a few times at Emerge we haven't been able to because like there's a trauma patient coming, so we just kind of kick them to the hallway sometimes because like that patient's passed away already, so we're trying to save other people. Yeah. During the flood there was like, and the heat dome, I guess it depends on the situation. During the heat dome, the crypt was so full of, we weren't able to put more people, so there wasn't even any room for all the dead bodies. So sometimes like depending on the situation, like a medical emergency or a natural disaster, we can't always be respectful because there's just so many patients or like cadavers. Yeah, so it depends on the situation. Yeah.
Okay. What role do nurses play in facilitating organ donation, and how does this intersect with the use of cadavers in Canada?
Oh, good question. So at the hospital, we do a lot of like, sometimes you do live donors where the patient's brain is dead, but their body's still alive. So like their heart's still beating and they're on life support. So it's organ donation after cardiac death. So yeah, nurses facilitate that conversation, but you have to be super sensitive and respectful of patients and their families, because if you talk to them too early, they think you just want to take the organs from their loved one. But since the fentanyl crisis, we have no shortage of organs for organ donation. So there used to be a really long list, now there's not much. So if you need an organ, usually you can get it pretty quickly. And I can show you the site on BC Transplant, and it shows how many people are waiting for livers, kidneys, and everything. So the wait's not that long now. And actually there's a disease, or there's a bacteria that's infecting a lot of the organ transplant patients, because most of the organs come from people living on the streets and they share the same IV needles. So a few patients have had this like crazy bacteria in them, and now they're finding that a lot of the people that got the organ transplants have this similar bacteria because a lot of them share needles together. So it's very interesting how the shift can happen based on fentanyl crisis or wherever, where the organs are coming from. But yeah, nurses are really instrumental in that, and it's actually really hard to keep a patient alive when they're going for organ donation, because usually the brain is dead but their body's still alive, so the brain actually does quite a bit. So we have to, it's quite a lot of work to keep that patient alive. We have to keep the blood pressure up, the heart rate up, but I think it means a lot to the patients, because like this patient died and obviously it's so sad, but then at least some good can come out of it. So my experience has been mostly good with it, but the bad side of it is the nurse that doesn't have a good relationship with the patient and the family, more the family I guess, then when they push it too quickly, then they don't trust you. So if you don't have that trust and you ask, then they kind of think the worst of you. And you have to also think about the cultural background. So certain cultures will never donate their organs. This has been my experience. So they believe in keeping people on life support until, like, for a really long time, even when there's no hope. So I think it depends too on the cultural background and how comfortable they are with organ donation. And if the patient registered for donation before the accident, it's a little easier for the family, because this is the patient made their directives known before the accident. So I find those situations, the family, it's very clear what they should do. But yeah, there's been a few times where yeah, they think they're going to go for organ donation, the last minute they say they can't, it's too hard. So that's always a little bit hard because the patients are waiting to go into surgery at the other end of it, and then they pull back, and then the patient doesn't give any of their organs. So, and then also a lot of it is eyes. So a lot of patients aren't candidates to give the hearts, lungs, and like the other organs, the solid organs, but they can do their eyes. So nurses, we usually, when the patient passes away, we put normal saline soaked gauze over the eyes and protect them. So even if they can't do their body parts, then we can do their eyes. But also depends why they died. So if they have cancer, you can't do it. If they have an autoimmune problem, they can't do it. If they're on cancer therapy medication, if they have an infectious disease, that's okay. Even if they have AIDS or hepatitis, they can still do it. So therapies for that. So it's surprising who can give and who can't sometimes. Yeah. So I've been a part of a lot of organ donations in the past. And yeah, I think a few of them have been pretty sad when they're young people, like, yeah, they're 18, 19, 20, and then seeing their parents say goodbye to the kids, pretty hard. But then we have the people come back to us who got those organs. So the people who got those organs from the people that passed away would come and talk to us. So that's pretty cool to see that end of things where you actually see people getting life after death. So yeah, and then the people who donate their organs to be cadavers, I haven't personally seen that. Like, I think that's usually people, at the maybe, I don't know how that works, but I haven't personally seen that at all. Yeah. I hope that answers your question.
Yeah. Okay. From your perspective, how critical are cadavers to advancing medical training and improving healthcare practices?
Well, that's a good question. So we do use it. So for example, there's this IV that we practice. It goes, if you can't get someone's like IV in their vein, we drill into their bone. So there's a cadaver lab that we practice doing that on cadavers, and obviously that's super helpful because having a screw drilling into your arm, if you did it wrong on a person, that would be quite painful. So in those situations, it's really helpful. And my friend, she's a cardiac surgeon, and she practiced cutting, and she opens up their chest for surgery. She practiced on cadavers first. And so to practice on a real patient that's alive, I think that's a little bit more challenging. And then also just seeing the anatomy, like, I know for me, seeing like when the doctors like crack the chest open sometimes in medical emergencies, like someone was stabbed in the neck and they had to crack the chest open and massage the heart. Seeing that for the first time, actually, when I'm working as a nurse, would be pretty shocking. I've seen that at the cadaver lab first, so when I actually saw it at the cadaver lab being done, I was pretty shocked. But then when I saw it in real life, it was shocking, but a little less shocking. So I think it's really critical to help prepare nurses and doctors well before they get into a life or death situation. And I also seen, like, we put people on life support, kids and adults, and so I saw where the tube goes and how the lungs inflate. So I do think it really helps people prepare well for their job, because really, how do you prepare people to be in these situations? It's hard. So, you know, in nursing, there's this like challenge in doctors too. The what you learn in school is so different from what you see in practice, but I do think this helps bridge the gap between theory and practice. Yeah, I wish we could show them more things, but it's so busy, it's hard to fit everything in. Yeah.
With advancements in technology such as virtual simulations, do you think cadavers are still essential in medical training? Why or why not?
That's a very good question. So at BCIT, we have one of the highest level sim labs, and we have virtual reality too. And so I do think maybe in the future we might not have to use cadavers as much because of virtual reality has improved so much. And the other thing that's great about it is they're more interactive. So we can get the high fidelity sim dolls to like vomit, they can pee, blood can come out of them. So they're a little more interactive. So I think in the future we probably won't be using them as much, but there's still some things like drilling in that IV into the bone that you can't really simulate that with fake bones and fake skin. But yeah, I do think it's really improved, like especially the virtual reality. And we have high fidelity lab. The government spent a lot of money on our sim lab, so we have one of the best ones, but the students will learn a lot about like how to manage situations, because the cadaver is not interactive at all, obviously, and there's no blood coming out of them, no body fluids, so a lot of that stuff is a little challenging to deal with, but the high fidelity dolls can simulate all that real life stuff. Yeah, so I think that probably in the future we might have less cadavers being used, but it also costs a lot of money, so most schools don't have the funding. Like Trinity Western, their nursing program doesn't have that at all, so we're pretty lucky to have it. Yeah. But hopefully in the future more schools will have it. Yeah.
Okay. What do you know about the legal processes and regulations surrounding the donation and use of cadavers in Canada?
Well, I know the rules about live organ donation quite a bit, but I don't know what happens for cadavers. I don't know too much about that. Yeah.
How do nurses cope with the emotional aspects of working with cadavers or discussing the topic with patients and families?
Oh, like organ donation? Or like wanting to do that? I think you have to have a really good healthy balance, and work not be your life, so that you have things outside of work. Also for me, my faith, obviously, believing in life after death, it's a little easier for me to talk about death, because some of my colleagues that don't believe in God, they don't really like talking about death, and even though we see it a lot, they do drugs and they sleep around a lot, so that doesn't seem like the most healthy coping mechanism. But for some of us who believe in God, I think like believing in that is helpful. And then the other piece of it is having friends that are nurses. So my sister's a nurse, I have friends, we talk about it, so it's kind of nice to talk about it. I don't know, how do you deal with anything in life? I just think you just keep dealing with it. Yeah. And then how do we approach talking to patients? Yeah, I think just like reading, having a good emotional intelligence, kind of reading the room if people aren't ready for it. Because a lot of times when people are in the hospital, they're in crisis, so I don't know if that's the best time. I think the family doctors, or when patients aren't critically ill, is a better time to talk about it. And I think having families talk to each other, I don't know if it's necessarily a nurse's job. Like I agree nurses are to help, but I think it's kind of our responsibility as people to like talk to your loved ones and see what they want to do. Like, hey mom, if you get really sick, like what do you want us to do? Like, do you want us to give your organs to donation? I mean, I talk to my family about it just because of my job, but I do think it's really important to talk about these things before you're in the emergency, because in that state of chaos during emergency, I don't think your brain's really capable of making that decision. So I think they have a lot of commercials and stuff on TV and advertisements to say, hey, maybe you should talk about this before you get to the hospital. And I think BC Transplant has done a pretty good job of talking about that, but that's kind of how I do it. Yeah.
Do you think the general public in Canada is adequately informed about the importance of body donation for medical education? How can nurses contribute to raising awareness?
Yeah, I think we can contribute to, I don't think a lot of people do know about it, and I think it depends on like your religious beliefs too, like if you want to be cremated or what you want to do with your body. But I do think nurses could probably be involved in it, just talking about like how helpful it's been to their education. Yeah, so I think that the laws are getting more strict, though. I heard from the lady I work with that they're getting more strict about the laws related to body cadaver donation. So I'll be curious to see what happens in the future. But I wonder if people are kind of worried about like what the government's going to do with your body, because people have less trust in the government these days. So I think there's probably some hesitancy to maybe give your human remains to an institution, because when you give your body to educational purposes, like what people don't really know, where is that going to go? Like, are you going to keep it in a lab? Like, what's going to happen? So I heard there's some ethical ramifications around that. People are a little leery of donating more because of those problems. Yeah, but I do think nurses play a role. I think everyone kind of plays a role. The education institution. But maybe with virtual reality, we might not need as many. So I think that's important to consider too, because we don't want to have a lot of human remains there, because the school has to keep them. So I know at BCIT we have a few human remains, and we're not allowed to dispose of them. Once you have them, you're not allowed to dispose of them. So, like, what are we gonna do with them? Yeah. Plasticize them, right? Put them in vinegar and formaldehyde and have them, because there is a few skulls on the back of the nursing office, and I was trying to find some paper, and I went back there and I saw the skulls, and I was like, dang, where are these skulls sitting here? But they're not allowed to throw them away. So now they're just sitting in this storage room that's like by the paper. Oh, it's a little creepy. Yeah. Yeah, have you seen that show, Bones?
I think Mackie and father used to watch it all the time.
Yeah.
I only like saw bits of it, so I don't know.
Yeah, that happened to them. So being like Bones in the closet, like,